Glen Rose Medical Center. Patient care. Excellence in compassion. Excellence in medicine. Glen Rose Medical Center delivers unsurpassed care to the people of Somervell County. Our services and facilities currently consist of digital mammography, a new radiology department, an advanced emergency room treatment facility, and of course an attentive and compassionate staff. Our desire as physicians of this hospital is to serve our patients with the best care and treatment possible. But in order to do that, we need more specialties, surgical subspecialties, pediatrics, and obstetrics. Our community continues to grow, which increases the need for more advanced treatment options. These needs include a community center with perhaps an Olympic-sized swimming pool for accentuating healthier lifestyles. Our nursing home and extended care program needs to be updated. Long-term goals include an intensive care unit with ventilator capacity, but ambitious goals require ambitious plans. In order to accomplish these goals, we need your help. We need a hospital district.
I am Dr. Karen Burroughs. I'm a family physician here in Glen Rose. Been practicing about 4 years. And I am interested in helping the community develop a hospital district in efforts to try to keep my patients home for their treatment. They're somewhat discouraged by having to go out of the area for specialty care, particularly surgical care. A benefit of a hospital district would be to be able to encourage specialty physicians from other areas to visit the community more frequently to provide care.
I came to Glen Rose 25 years ago in March of 1987 to a small facility that had diagnostic facilities at that time which were outclassed by most doctors' offices. Over the last 25 years I've watched this place grow to a modern, pretty much state-of-the-art hospital with all the diagnostic facilities that you would need as far as lab work, x-rays, CAT scan, ultrasound, etc. What we lack at this point is the ability to utilize those diagnoses and treat the patients locally. We need to grow our treatment capabilities such as general surgery, specialty care, other types of specialties such as pediatrics. Unfortunately, in most cases, I can diagnose most of the problems you might have, be it appendicitis or pregnancy or colon cancer. But if you come in with an appendicitis, I can't treat it here unless it's in the middle of the day, in the middle of the week. I can tell you you're pregnant, but I can't deliver your baby here. I can tell you have colon cancer, I can even schedule your general surgery here, but I can't treat you with chemotherapy or radiation here. And I would urge your support in our efforts towards a hospital district to give us the funds to make this facility as good as the citizens of Somervell County deserve. Thank you.
We are a small hospital. We love taking care of our community and our patients. We have a very diverse group of surgeons and physicians that come here to entice those people to get here and to come here and to use our facility. The technology is where we're lacking. We've got enough technology to get us by with what we do. Some of our equipment is old and outdated and even obsolete. We had an orthopedic surgeon here a couple of years ago that was on staff, and he kept us busy. Since he's been gone, we don't do half the orthopedic cases that we used to do. We're perceived as a small organization from our competitors, and I'm speaking of Granbury and Stephenville. Right now, we're not even keeping up with the pack.
My name is Josh Pendergraft. I've been here for a year and a half. You know, one of the things that I really look at is our business model for MRI. We have a company that comes in and does our MRIs mobily. But the biggest problem to me is we have a business model that's set up to punish us by growing our business because we're set up as a fee per scan. You know, Stephenville and Cleburne both use the same DMG company that we do. And so I see an opportunity to strike first and put MRI here When you start talking about $1 million MRIs, people get a little nervous, but it's not money that we're just having to come up with. It's money we're already spending. We do a lot of angiography on this CAT scan that's here behind me. We lose a lot of business for diabetic patients, for patients who cannot have contrast injected because of poor kidney levels, or poor kidney function, I should say. All those patients that we lose in CT, the MRI allows us to do angiography without injecting contrast. So not only will we get the business we already have, we also pick up that business that we drop off in CAT scan. The offstanding imaging centers are fading, and they're fading fast. The time is now. I mean, we have an opportunity to jump ahead of the curve and get a magnet in here and get people used to sending their patients here. Not only are we thinking this, I'm sure the administrators at Stephenville and the administrators at Cleburne are thinking the same thing. We are a nice local point between both of those big cities, and I just think that's one of the things that we really need to address, and we need to address it quick. Another thing that people really don't take into consideration is we have to be, number 3 or number 4 employer in the whole county. Not only do we have the hospital, we have the clinics, we have the nursing home, we have home health, we have physical therapy, we have a little bit of everything, and there's lots of employees whose families depend on this hospital.
My name's Tammie Apodaca, and I am the Director of Rehab for Glen Rose Medical Center, and I would hope to eventually be able to provide the facility as well as the community with a freestanding rehab facility where we could provide outpatient rehab services, use it for our inpatient services as well, and be able to provide a wellness facility for not only our employees and patients, but as well as to the community, where they would have access to exercise equipment, personnel to help them with their workout plans, and access to also a swimming pool inside that facility.
I'm Dr. Julia Hutchinson. I have a internal medicine practice here at Glen Rose Medical Center. And what I would like to see for our community is an upgraded nursing home and an ability to offer more services for our Alzheimer's unit. I would also like to see some diabetic education for the entire community. We have quite a few of our residents in our nursing home. A lot of our patients need some extra care with regard to memory loss and some other special needs. Space is in short supply. I want a new nursing home.
As you can see, we have a very modern and updated emergency facility, and we're very proud of it. It's recently built. As much as we do, there's so much more to be done. I can recall when I first went into practice, I practiced in a small town in South Texas called Sweeney. And even though it was a town not much bigger than Glen Rose, at that point we formulated a hospital district to manage our hospital. For just a few pennies of tax money, millions of dollars were generated for various purposes in the county. But one of those purposes came to be to sustain a hospital district, much like a community would sustain a school district. We had a small town with a hospital of 40-bed capacity, much more so than here. We had full services. We did obstetrics and gynecology. We did all of the major surgeries that can be done in an outlying hospital. We had an intensive care unit. We had all of the things necessary to take the best care possible of our people. It was just a way to be sure that the community had all of the things that they needed for the health care that they desired. In our community, right now, there is no hospital district. And so at this point, we are reconsidering the idea of a hospital district. We really feel like it's the best way to manage and maintain a hospital in a small town. And the best care possible requires money. And to get the money, we feel that the best way to do that is through financing the hospital through a hospital district. We ask that you consider one question. Do you really want a hospital or not? If you really want a hospital in this town, then it's going to take something like a hospital district to keep it here. We ask for your concern and your commitment and your vote to make this a possibility for a hospital district in Somervell County. Thank you very much.